Now, a warning for women and a push from doctors to visit your OBGYN. Dr. Lisa Barolette is a gynecological cancer doctor at UW Health. September is Gynecologic Cancer Awareness Month. So we want to talk about these cancers. What are these cancers and what puts women at risk for developing them?
Hi, thanks for having me. I take care of women with ovarian cancer, uterine cancer, cervical cancer, vulvar cancer. They're all very different, and there's different risk factors. In general, cancer is more common as we age. Ovarian cancer can be more common in patients who have certain family histories or hereditary conditions. Uterine cancers are more common for patients who are overweight, but we're also seeing an increase in the Black and African American population, even in patients who are normal weight. So we really need to be monitoring and raising awareness for these cancers.
What would you say are some signs or symptoms women should pay attention to?
Ovarian cancer is really tricky. The symptoms are vague. They can include feeling full after eating just a few bites. You feel like your belly is swollen. You might feel pelvic pressure. But understandably, these symptoms are often confused for gastrointestinal disorders and are ignored, or the workup isn't the right workup. So it's important that we keep ovarian cancer in mind. Uterine cancer, patients will often be after menopause and notice vaginal bleeding, which is definitely an abnormal symptom that should be evaluated. And vulvar cancer, often it's like a skin cancer. So it'll present as a lump or bump, and that needs to be addressed right away.
What would you say should be the first step? And if you don't get the results that maybe you need, what should you do after that?
I always say start with your primary care doctor or OBGYN, someone who knows you well, someone who's going to listen to your symptoms, someone who's going to evaluate exactly what you're experiencing and get you to the right person for additional workup.
And this month especially is a push to make sure that you are an advocate for your health.
Absolutely. I think in general, we've learned that women, when they complain of pain or have symptoms that don't make sense, they often can get pushed aside or ignored. And it's really important to make sure that abnormal bleeding patterns, new lumps or bumps that don't make sense, or gastrointestinal symptoms that aren't being worked up appropriately, include gynecology, include your OB-GYN in those conversations.
All right. And thank you so much for your time this afternoon. We appreciate it.
Thanks for having me.